Hi, my name is Laura Johnson, and I am doing Case Study 17.3 on Mildred Perkins. This case study focuses on a woman named Mildred Perkins. Mildred is a 75-year-old Caucasian woman. She is currently married to her husband Ray, who is 80 years old. Ray and Mildred are both retired, but have been extremely active throughout their retirement and have traveled extensively throughout the country. Mildred has one daughter, Janet, whom she moved to be closer with a few years ago following Janet's divorce. Mildred was hospitalized about a week ago for a newly diagnosed diabetic condition. While she is recovering well, her daughter has noticed some strange behaviors and has found Mildred to be increasingly forgetful. With very limited information regarding Mildred's health and medical history, and without speaking with Mildred personally, it is very difficult to make a firm diagnosis. As far as I know from the information provided, and based on the fact that Mildred has been able to travel with her husband, I can presume that Mildred has been fairly healthy. This leads me to eliminate some neurocognitive disorders, such as those caused by diseases like prion, Parkinson's, or Huntington's. A few possibilities that stand out in my mind are a neurocognitive disorder due to Alzheimer's disease, or a neurocognitive disorder due to a medical condition. Mildred did not recognize her daughter and thought she was one of the hospital staff. This confusion and decline in memory and cognition certainly point to an NCD, possibly to Alzheimer's, but I cannot be certain regarding the cause at this point. It is possible that Mildred's diabetes is related to this episode. Some research has indicated that diabetes is linked with neurocognitive disorders in people with HIV. However, this is information we do not have regarding Mildred at this time. Mildred has displayed a number of concerning behaviors consistent with a neurocognitive disorder. In addition to not recognizing her daughter, Mildred has been repeating herself in conversation and has been unable to remember and retain basic information. Mildred has been seen wandering and has displayed a great deal of confusion. Mildred was confused regarding the month and year. She was confused regarding the length of her stay in the hospital, and Mildred inaccurately believed that Ronald Reagan was the President of the United States. Mildred did not remember her daughter's visits to her in the hospital, and she has displayed some strange behaviors, including placing her clothing in a garbage can, believing it to be a suitcase. After observing Mildred, there are several other steps I would need to take to gain more information about Mildred's case. I would want to speak with Mildred's husband and ask some questions to determine her normal levels of cognitive functioning. I would want to know if Ray has seen evidence of cognitive decline in Mildred and gain some more specific information. I would also want to contact Mildred's primary care physician to obtain her medical history and learn of any other medications she may be taking. Finally, I would want to consult with a neurologist to complete additional testing with Mildred. While I cannot be certain with this diagnosis without further testing and additional information to rule out other possibilities, my primary diagnosis for Mildred would be a mild neurocognitive disorder due to Alzheimer's disease. I would make this diagnosis based on Mildred's significant impairment in memory and learning. Her forgetfulness and inability to remember information taught to her by the nurses all fit with this diagnosis. I believe this is a mild case because her visual, constructual, and perceptual motor ability and language have not been impaired at this point. And while she has been wandering, Mildred has not shown irritability, agitation, or combativeness, all associated with major NCD. Some psychosocial and cultural factors that could apply to Mildred would be non-adherence to medical treatment and wandering associated with a mental disorder. Because Mildred has been unable to learn and remember the nurse's instructions regarding the care for her diabetes, Mildred is mentally unable to comply with her medical treatment independently. She has also displayed wandering and confusion with this disorder. Following a diagnosis, I would meet with Mildred's daughter and husband to assess their strengths and resources. I would want to assess how the family views Mildred's condition and explore their cognitions. I would also want to determine what resources they have available to them to deal with Mildred's illness. There are many factors that I would want to help the family think through as they make plans to discharge Mildred. I would help them think through who will be responsible to care for Mildred. With her recent diagnosis of diabetes, Mildred will need someone to check her glucose levels, administer medication, and regulate her diet. She will also need someone to transport her to appointments, go grocery shopping, and do other household tasks. With her husband being 80, the family will need to think through what he is capable of doing and what he will need assistance with. I would want the family to think through Mildred's living situation. Can the family afford nursing care or aides to provide support and care for Mildred at home, or will the family need to consider assisted or independent living options? There will be many changes taking place for this family, and I would attempt to make those changes happen as smoothly and painlessly as possible.